Hi everyone, good evening. I hope you all are doing well, guys. Hello. So, am I audible, guys? Am I audible and visible to all of you? Yes, please answer. Okay, great. So, I'm perfectly fine, audible and visible to all of you. That's perfectly fine, right? Okay, great, great. Wonderful, guys. So, okay, let's not wait. Let me see. Okay, people are live even on the YouTube. I could see here. Okay. Yeah, so yes, people are even live on the YouTube. Okay, let's start, guys. Let's start. Let's not wait. So, guys, again, I welcome you all to this wonderful webinar and the free demo class on cancer etiology, right? So it's a very simple class. I mean, everyone we know, but I want you to, understand the things, and I want you to discuss the things. Okay, I want you to discuss the things, not only me, right? And this class is also the demo class for our upcoming course. The date of that course also has been, it's over already, and but as we are having the demo class, this will be today you guys can register to that course if you wish. Okay, if you guys wish, you can register to this course. So let me just take you through 1 minute. So this is the course. This is the one go course, guys. One go course. Okay, one go course means there are no modules, there are no multiple modules. This is just one course. Okay, this is just one course, and there are no multiple modules. Okay, like module 1, module 2, you have to complete all. No, this is a one go course. So the best part of this course is this is one go course, and the second best part of this course is this is also affiliated to Gitanjali University. So you will get the certificate given by the university and CLIMED both, right? So this course is given by the Gitanjali University, the master certificate course in oncology. So this is a one go course. Definitely you will get a lot of things, and the course cost is just 999, because this course is quite lengthy. Okay, this will go for 4 to 6 months. Around 2024 classes will be taking here, as you can see in the syllabus. So here is the syllabus: 24 sessions, including all the cell biology, cell cycle, growth factors, all the risk factors, genetics, tumor suppressor genes, pathology, metastasis, angiogenesis, etiology of the cancer, cancer screening, molecular biology of the cancer. I mean, and we will be covering entire thing about these cancers with their presentations, diagnosis, treatments, and prevention. Sarcoma, head and neck cancer, breast cancer, gynecological cancers, skin cancer, gastrointestinal cancer, and cancer of central nervous system, cancer of central nervous system, and thorax cancer, right? So this course is also affiliated to the university. So if you wish, guys, you can register today. It is just 999 rupees for 6 months course. So it won't be, it is not at all costly if I say. Okay, and there are a lot of people already registered, but as this is our tradition, like if we are having the demo class on the demo class day, we will give you the chance, last chance to register. And this is starting tomorrow. I mean, day after tomorrow, Sunday, right? So we are starting a demo. I mean, our orientation class will be on the 2nd June. So you guys can still register by tonight. Okay, if you wish to register, I'll be sharing the link at the end, and feedback link as always will be shared at the end of the class. And I can see there are the people who have not kept their name. Guys, please keep your name, complete name. Someone has just put the dot, so my team has to take the attendance. So please put your full name. Okay, someone has just put one dot at his name. So everyone, please change your names, the Zoom names, to the original name. Okay, whatever is your name, don't keep these, otherwise you will not be included for the certificate. Remember this, right? Okay, great. So, in today's class also, I'll be just touching basics, but I have brought 4 cases for you guys. Very simple 4 cases, very simple 4 cases, like to make you curious to know more about the cancers. Okay, there are 100 types of cancer, 100 types of cancer. Like, there are the different etiological basis, genetical basis, part tissue basis, and all. There are multiple types of cancers, but we'll be discussing four very special cases here. So here only about the sign and symptoms, and some special things we'll be talking about those cancer, right? And along with that, we'll be talking about the types of cancer and the etiology of cancer and prevention of cancer. So guys, one important thing here for you is I have not prepared the slides for today. Okay, I prepared, I mean, the four cases only I prepared, but I have not prepared the other slides. Okay, and why I have not prepared the slides? Because today's class, I and you both will be discussing together. Okay, so we both, I mean, we all will be discussing together, and I want your cooperation, your participation in the class, then only I can make it successful, right? So let me share the class. Here is the class, guys. Okay, so here is the okay. I hope it is visible to all of you. Okay, I hope it is visible to all of you guys. Okay, let me make it full screen. I am recording this meeting, so you don't have to record it any. Okay, you don't have to record it. I can record, I am recording it, and we are also live on the YouTube, so you can watch it anytime, even immediate after this thing you can. And guys, I'm telling you initially only, if you want certificate, you have to fill the form within the webinar. Okay, and it is strictly prohibited to share this form in any group, okay, with any friends, because your attendance is also taken by my team. So if you are being smart, you are trying to be smart here, like, okay, we'll see, like, we'll share with everyone and we can understand the things, we can fill the form, we can get the certificates, but your name will be matched with the attendance what my team is taking at different point of time, right? So don't try to be smart with us, right? Okay, so let's start, guys. Today's class is again the wonderful class on cancer etiology and prevention, the demo class. So again, we have the classes, I mean the cases, few cases. So I'll be starting with find the diagnosis. These will be the questions to the audience. Okay, guys, these will be the questions to the audience. Okay, I'm so sorry. Yeah, these will be the questions to the audience. Okay, and audience has to answer this. And then about etiology, risk factors, cancer prevention, cancer types. I did not get any PPTs. We'll be discussing all together. Okay, so let me share the first case. Let me say the first case. First case is a 56-year-old post-menopausal woman. Okay, guys, carefully. Just this is just 1 hour class. Okay, just focus. This is I have brought these cases from like multiple good resources. Okay, like NIH and National Institute of Library and National Library and this big journals like NEJM and BMJ. Okay, so please focus here. It is very important to understand. There is nothing much. I have not, taken all the entire case, just the simple things about the case. Okay, but you will be understanding a lot. So the case is 56-year-old post-menopausal woman went to the hospital because she found a lump in her right breast. Okay, right breast. So what do you think this case will be around, will be about, guys? I mean, with the first line, I mean, you can read the entire slide, but with the first line, what do you think this case is about, guys? Yes, tell me. Anyone? Breast cancer. Okay, breast cancer tumor. Let's stick to the breast cancer. Okay, let's see now. Let's see now. Now, this is the first thing. See, with the first thing only you understood the things. But can you please one more thing you have to elaborate. One more thing you have to elaborate. Risk factors. Risk factors for breast cancer. Guys, risk factor for breast cancer. Now, complete question is mentioned in the first line. Can you please tell me the risk factors for breast cancer mentioned in the first line? Yes, guys. Okay, menopause. Genetic inheritance. Where is the genetic inheritance? Here, no genetic. First, I'm asking my simple question is risk factor for breast cancer from the first line. Okay, menopause. Okay, okay, great. So here, not only one, but there are two risk factors, guys. There are two risk factors. One is the age, and the second is post-menopausal status. Okay, the post-menopausal status and the post-menopausal status and the age. So can someone tell me, can someone tell me how menopause is associated with the breast cancer? Gender, or a breast cancer is okay, gender you could say, but gender is not the generalized thing here, because the generalized thing is it is happening, breast cancer is usually happening in the women and in male. Okay, someone has gave me the another question, guys. Someone has given me the another question. Can you guys tell me, if there is the breast cancer, if I say the chest cancer in the like nipple cancer in the male, what it is called as? Can someone tell me what it is called as? In the male patients, if they have the nipple cancer or chest cancer like the breast cancer, what it is called as? Gynecomastia. Exactly. Exactly. That is called as gynecomastia. Okay. That is called as gynecomastia, not the breast cancer. Okay. Not the breast cancer. So I mean, gender is a very generalized thing here. Gender is not the risk factor here, because breast cancer means only the women, right? Breast cancer means only the women, right? So that's why I'm telling, like you have to think of. So in the first line, there are two things. One is age. Second thing is menopausal women. As you guys have written very nicely, okay, as you guys have written very nicely, like there is no estrogen, so there is always there is always hormonal imbalance, and due to that deficiency of estrogen can happen. I mean, and due to that, there are the high chances of getting the benign tumors and benign cancers, or the breast cancer, what we say, right? So this could be the case of breast cancer, and these are the two risk factors. Now let's go to the next line. She had no other clinical symptoms. See, how the patient represents to the hospital, how the patient presents to the hospital is like no other clinical symptoms at all, nothing is there. No pain, no skin color change, no nipple retraction, or no nipple discharge. Can you imagine? There is no symptom, there are no symptoms in such cases. Only one thing is that is lump, that is the lump. Okay, that is the lump. Other than that, this lump is even not paining. Skin changes, nipple retraction, or nipple discharge, nothing is there. Okay, now again, the negative part here is she denied the family history of breast cancer or any other tumors. There was no other tumor or no breast cancer in the family. Okay, no breast cancer, no other tumors in the family. So guys, again the question comes here is, again the question comes here is, like, see, why we say that early detection. Okay, the question here is early detection. I'm not asking you the question, I'm telling you this is a general question. Why early detection is important, why screening is important, okay, for the breast cancer. Okay, now my question to you is why, I mean, how, what is the mean? Mean means like what is the process of doing the screening in women for breast cancer? Can you please tell me? Gynecomastia is the malignancy, but it can convert into the carcinoma later, rectal carcinoma or many other things. Yes, gynecomastia is not exactly the cancer at the first stage, but it can convert into the malignancy later. Mammogram, yes, mammogram or breast biopsy. Okay, breast biopsy or mammogram, right, guys? Breast biopsy or mammogram can be done, right? Can be done. Breast biopsy or mammogram. First thing is mammogram. What is mammogram based on? Yes, guys. Now you tell me, what is mammogram based on? What is the, I mean, the principle of mammogram? Yes, anyone? You remember yesterday's class? You remember yesterday's class? Yesterday's class, how many of you remember? What is the principle of mammogram? Can someone tell me? Can someone tell me? What is the principle of mammogram? Mammogram is also ultrasound, ultrasonography. Okay, sound waves like echocardiogram. Mammogram is similar to the ultrasonography or echocardiogram. That is also the USG, ultrasonography. Okay, mammogram is not using any kind of rays, but it is using the sound waves. Okay, it is using the sound waves, right? And why we do the mammogram? We just check the location and the size of the tumor or size of the changed cells, physiologically changed cells. Okay, physiologically changed cells, right? That's how we do the ultrasonography, or we call it mammogram, right guys? Mammogram, we that's why we do the mammogram. Now my next sentence here is, on the physical examination there was a 2 into 1.5 centimeter mass at 12 o'clock in the right breast. 12 o'clock in the right breast means at the straight above part of the breast, right breast, there is the lump, there is the mass of 2 into 1.5 centimeter. I mean, that is the diameters of the the mass. Okay, and that is 0.5 centimeter away from the nipple. Okay, like 50 from the nipple, that is the mass, right? So when we did in the ultrasound and when we did the biopsy, we got to know that lump was formed. I mean, lump was formed, movable and irregular. The rest of the physical examination showed no obvious abnormalities. So this is like we are confirmed that there is 2 into 1.5 centimeter mass, that is like lump at in the right chest, just 0.5 centimeter away from the nipple. Now my concern here is, my even the next question to all of you here is, okay, we talked about mammogram and all, right? If you guys can tell me just a brief, if you guys can just tell me a brief of treatment part of the breast cancer. Okay, but not now. Treatment part of breast cancer, type of treatment part of breast cancer, right? But before that, let me go to the next thing. Here you like look at this, guys. Okay, we are talking about this case. Here is the case. See, so this is the breast, right breast. This is the nipple here. You can easily see, and 0.5 centimeter to the above part. Look at this part. Look at this part, guys. Look at this part. Mammogram it is showing. See, it's very carefully. It is very important to see. This is the dense echoic area. Dense echoic area you can see in the ultrasonography. And if you look at this from the side, from the left side, here, here. If you look at this, the dense echoic area. Okay, dense echoic area in the ultrasound, this is the main lump. Okay, and when we did again the try to go for the, I mean, in the ultrasound only, mammography only, you look at this, this is the area of the tumor, area of tumor. And now if you look at the CT scan, we did the CT also, so here if you look at the CT, look at this, look at this part, this exactly. Okay, this exactly here, this part. Okay, here, this part, this part here. Okay, and in this also, here you can see somewhere here. Okay, so there are multiple things you can see from the different viewpoints. These are the, this is the CT, this is the mammogram. Okay guys, this is the mammogram images of the breast cancer in the right breast, right? You can easily detect. See, let me tell you again, let me show you again. See, this is the breast, right? Okay, this is the right breast, and here this is the nipple, and above side, I mean, this is as the parallel view. Okay, this is from the, this is not the frontal view, this is the side view of the nipple. So you can see here is the dense mass. Okay, here is the dense mass. Usually here it is dense only, but here it is too dense. Okay, it is too dense, and from here echoic sounds were noted, high frequency echoic sounds were noted. So this area, if I see from the frontal part, frontal side part, if you see, here is the the lump, here is the tumor. Okay, here when we tried in the color view, so you can see here, this is the part where you can see the tumor, and black and white, this is the tumor part, this is the tumor part. Okay, in the ultrasonography. And when we did the CT scan, from different views, vertical, when we did the, horizontal cut, this is the thing. Okay, and this is the thing, this light thing. Okay, this is the thing, and here you can see this is the thing. Okay, here you can easily quick sound, like everything, the all tissue is shown to be white. Okay, all tissue is shown to be white, but this is the, blackish area. So this is, and these two are the lungs. Okay, here you can easily identify the lungs. Okay, these are the lungs, right? And this area is the tumor. Okay, and here again, when we see the, in the another image of CT, you can see this area is, the right side of the chest. You can see here. Okay, and lump, oh sorry, not this, sorry, in this image this is not the lump. Okay, sorry, in this is not the lump, this is the lump here. This is the lump here if you see here. Okay, here if you see, this is the lump. Okay, this is the back bone, the vertebral. Okay, this is the vertebra, entire vertebra, and this is the right chest, this is the right breast, and here you can see easily in the side views. Okay, and these are the these are the all horizontal views of the CT. You can easily detect it. Okay, guys, and this is the article ID. You can check the article, you can read the entire article here. Now, what is this exactly? This is primary squamous cell carcinoma of the breast. Primary squamous cell carcinoma of the breast. Now, guys, we have the diagnosis, we got the CT scan, we got the mammogram. Now, we understood what exactly the case is. Now, tell me, now my question was, can someone tell me what are the treatment parts for the breast cancer? Treatment part, just general thing, treatment part. Can someone tell me the treatment part? Yes. Mammoplasty. What is mammoplasty? Tell me the mammoplasty. Okay, someone is writing mammoplasty. Mammoplasty. Okay, I will write mammoplasty here. What is mammoplasty? Removal of the lump. Lump, not lump. 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 Removal of the lump. Chemotherapy, surgery, chemotherapy, radiation. Okay, surgery, chemotherapy, radiation therapy, mastectomy. Okay. Okay, so I will just divide the treatment part into, I will just divide here. Treatment of breast cancer, right? First, let's talk about chemotherapy. I'm not going into the drugs, just asking you, like this is overview. Chemotherapy, right? Second thing is hormonal therapy. Hormonal therapy is also workable in breast cancers. Okay, hormonal therapy in multiple other cancers also. Then the third thing is here what we can see, radiation therapy. Okay, radiation therapy. And the fourth is surgery. Okay, fourth is surgery. Now, can someone tell me what are the types of surgery? Okay, someone is telling mastectomy. Mastectomy. Okay, mastectomy. Okay, what is the mastectomy? Radiation surgical mastectomy. Okay, mastectomy. Yeah, lumpectomy, mastectomy, whatever you say. What is that? Okay, so guys, let me tell you one more very interesting thing about the breast cancer surgeries, breast cancer treatment. One is partial breast removal. Okay, wherever is the lump, you just remove that. Partial breast removal. And second thing is MRM. MRM is called as mastectomy, as we are telling. This is the complete breast removal. Okay, this is the complete breast removal. Okay, can you understand? If I talk about the surgery, again here, guys, focus. One is MRM, mastectomy. Okay, complete breast removal, we call it. Okay, complete breast removal, right? And another one is partial breast removal, and that is like only removing the lump, right? Only removing the lump. So which one do you think is the perfect one? Which one do you think is the correct therapy? And what are the consequences? I want you guys to think, more than the therapy here. I want you guys to think more than the therapy, the benefits and consequences of these surgeries. Can someone tell me which one is good one? Mixed reactions. Someone is writing MRM, someone is writing lumpectomy, someone is writing partial. Depends on the severity. Okay, depends on the severity is like, okay, let me tell you here, just take this case only. We're not going further to the case. This is just 1.5 into 2 centimeter lump at the upper side of the breast, 0.5 centimeter from the nipple, right? So in this case, Like if you are the decision maker, which one do you take it? Which one do you take it? Partial lump remover or the complete breast removal? Yes, guys. I've given you the scenario. Partial. Okay, people are telling partial, partial, partial. Partial, okay, partial. I understand. I get it. I got your case. I mean, I got your decision. You are telling partial. But why partial over complete breast removal? Why complete? Why partial over complete? Why? Okay. What are the consequences, guys? What are the consequences? Complete removal is not necessary. Okay. Okay. Anything else, guys? Benign. Okay. Likita is writing benign, I believe. So, guys, tell me now my specific question, because I'm thinking and I'm seeing that you guys are not reaching there where I'm reaching here. You guys are not able to reach. Tell me, my specific question is socio-economic, social impact. I will write. Okay, social impact of breast cancer surgeries. I want you guys to think beyond the treatments. Social impacts. Yes. Lead to depression. Okay, issues, women's complete removal, recurrence, breast conservative therapy. Partial breast removal is called as breast conservative therapy. Okay, BCT, we call it BCS, breast conservative surgery or breast conservative therapy. BCS is the partial one. Okay, embarrassing the payment, preserve normal gland functions. Definitely, these are the things. So, okay, guys, let me tell you. I'll tell you two cases. I did one project. My master's project was on breast cancer. So let me tell you what I've seen. Okay, these are the personal stories, very personal stories. See, we call them, first of all, we call them breast cancer survivors. Okay, breast cancer survivors, not the patient who are lived after breast cancer survivors. And they face what? They face what? They face self underestimation, first of all, self underestimation and self consciousness, because there is no breast. Okay, if in case of complete breast removal, there is no breast, right? So breast is something which is very important part of the body for women, understand? So they feel the self consciousness, or the guilt, or if I say they underestimate themselves. They don't want to look into the mirror. Okay, they are scared of looking into the mirror. Okay, they are scared of looking into the mirror, right? They cannot see themselves. And you know then the social stigmas are there. Social stigmas, what people say, what people think, how people think about them, how they react to them, and how these are the big thing. And they get into the depression, they get into the anxiety, they get the societal thoughts and all. And I have seen two of my patients even got divorced by their husbands. I mean, the families are not, that much cooperative, and families are not that much aware, not much educated. So they don't understand the things, right? They don't understand that this is a problem. They don't understand that this is a problem. So two of the women from my study got divorced from the families. Inferiority complex, social withdrawal, exactly, right? So inferiority complex is there, and divorce, the family, family separations is one of the major factor. Okay, I like the major the what we say, family separations is one of the major consequence of the breast surgeries. Okay, and self underestimation maybe. And then why these people get separated. Let me tell you the truth, guys, because my study was on the social stigma and the social behaviors on the breast cancer survivors. Okay, so the people, why women underestimate them. First of all, the look. They cannot see in the mirror, right? Second, they are not sexually they feel they are not sexually attractive or sexually satisfying the partners. There are multiple things what they think. Major things were related to their self consciousness of the beauty, of the health, I mean of the body. And then, like, they feel they are not sexually fit for their partners, and they are rejected by their partners multiple times. Okay, so these are just few major things what the breast cancer people understand. And clinically, if we say clinically, there are multiple things. If there is a breast cancer, then there are the direct impacts on the heart, like heart attacks, heart failure, arrhythmias, because of the hormonal changes, because of the chemotherapy, because of the radiation therapies. There are multiple things they face, the breast cancer patients, breast cancer survivors face. Okay, so these are the social stigmas and social consequences. Okay, rest you can take care of the things, guys. This is about the breast cancer, the little about the breast cancer. Now, the case number two. Case number two. First of all, the case starts with, this is a 73-year-old man. 73-year-old man was admitted to our hospital for a routine health check. Okay, routine health check, and found a lung nodule by chest x-ray. Lung nodule by chest x-ray, right? Let's understand. He had a history of smoking. He had a history of smoking. He had smoked a pack of cigarettes a day for the past 20 years and has now quit smoking for 9 months. 9 months. So my question after these two things, what is the diagnosis? First thing is diagnosis of this case, and second thing is risk factors here. Risk factors here. Yes, guys. Lung cancer, absolutely. Lung cancer, we are talking about the lung cancer, right? We are nothing but talking about the lung cancer here, right? Now in the lung cancer, absolutely, this is the lung cancer. Smoking and age, okay? Smoking and age are the major risk factors. Okay, age is secondary, smoking is the primary. Smoking is the primary etiology here. Etiology here for the lung cancer. Okay, etiology for the lung cancer is smoking here. And if you see here, the history of smoking is prominent. 20 cigarettes almost a day for past 20 years. For past 20 years, right? For past 20 years. So when inquiring about the condition at the outpatient clinic, he denied any symptoms of such as chest pain, hoarseness, the hoarse voice, hemoptysis, cough, difficulty breathing. These are the symptoms. Okay, these are the usual symptoms, but he denied that there is no symptoms like chest pain or hoarseness or hemoptysis, cough, or difficult breathing. Physical examinations revealed normal breath sound in both lung fields. Can you imagine? Both lung fields have the normal sound. Normal sound. So this severity, the symptoms also shows the severity, guys. Okay, symptoms also shows the severity. So this case was not severe, not very severe. Okay, this case was not very serious. Sir, will withdrawal symptoms contribute to the cancer? No, withdrawal symptoms never contribute to the cancer or any disease. Alcohol withdrawal syndrome is the is one of the syndrome. Okay, is one of the like combination of multiple reactions of neurological symptom. Okay, but withdrawal symptoms usually does not cause like the cancer and all. Hemoptysis is the like not exactly the blood vomiting, but if the blood comes with the cough or maybe in the vomit or something, so that is like blood is coming from the mouth. Okay, reason could be anything. Okay, reason could be anything. That is called as hemoptysis. Okay, hemoptysis is blood is coming from the mouth. Okay, and that could be because of the erosions. That could be, I mean, not only the cancer I'm talking about. There are multiple reasons for hemoptysis. That could be, like maybe because of the erosions, gastric erosions, gastric refluxes, gastric problems, and gastric ulcers, and then the lung cancers is one of the reason, and severe infections are the reason, and heart related problems are the reason, like Eisenmenger syndrome, and multiple things are there for the hemoptysis. Okay, hemoptysis, there are the multiple reasons. Food poisoning is the simple symptom of hemoptysis. Okay, food poisoning is one of the simple system of leukemia and all. I mean, those are the typical cancers, but I'm telling simple symptoms, simple conditions like simple conditions like food poisoning can get the hemoptysis. Okay, so here everything was normal. There was nothing, no symptoms. So there was no obvious abnormalities in the laboratory test results also. Everything was fine. The results of his lung function test and cardiovascular examinations were within normal range. Everything was perfectly normal. Only he had a lung nodule in chest X-ray. Okay, only the condition we saw was lung nodule by chest X-ray. So then next we did is a contrast enhanced CT scan revealed a soft tissue mass measuring 2.5 centimeter to 3 centimeter in the lower lobe of the right lung. Lower lobe of the right lung. Lower lobe of the right lung. There was a, kind of mass, soft tissue mass, which was 2.4 cm to 3 cm, which was shown in the X-ray, right? So other than smoking and the very old age, there are no other reasons, no other risk factors, but these are the major risk factors, guys. Okay, these are the major risk factors for lung cancer. Lung cancer. These are the major risk factors. Now let's see CT scan. So let's see the CT scan. Where is that? Can someone tell me where is the cancer is then in this image? These are the CT scans. These are the CT scans. These are the CT scans. Yes, can someone tell me? Lower right side. Which one is lower right side? Okay, I'll take. Is this the lung cancer? Is this the lung cancer? Is this the thing? Can you guys tell me? Is this the thing? Yes. Yes. It's nodule. Guys, now, okay. I have a very, very important question to all of you. I mean, see, you must have read the anatomy, right? You must have read the anatomy. Yes or no, guys? Read the anatomy? Read the anatomy? Yes. Read the anatomy? Okay. Now tell me one important thing. Which is this area? This area is what? This area. I mean, I'm telling you, this area is what? This area is what? This is the back side, like the back or chest. Tell me. This is the back or chest side. Tell me. No, don't tell me yes, yes. Don't tell me yes. I'm not asking yes. Tell me it is back side or the front side. Why back side? How can you say this is back side? This is a very important learning for all of you. Very, very important learning for all of you today in today's class. Tell me why it is back side. Yes, guys, tell me why it is back side. How can you say this is back side? Yes, space for spinal cord. Space for spinal cord. Wonderful. I think you guys are very smart, right? You guys are wonderful. Let me tell you, you guys are very smart. So this is the back. Okay. This is the front. Now tell me which side is right. This side or this side, this side or this side. Which one is left or which one is right? I'll write. Yes. Which one is right? If this is the back and this is the horizontal uh, view, horizontal cut in the CT scan from the head side, then which one is right? Yes, guys. See, here's a very important lesson for you. This is left side. This is right side. This is left side. This is right side. Okay, and this person has the lump or the nodule in the lower right side. Lower right side, right? Am I wrong or right, guys? Yeah, lower right. Lower right lobe. And when I asked you that is this the tumor, you every one of you said yes. Was it logical or illogical? Tell me. Nodule is in left. How can you say that nodule is in left? This is the same patient's CT scan. This is the same patient's CT scan, guys. This is the same patient's CT scan. Oh, guys, what should I do with you? Tell me. Yes, anyone? Or now no one will speak, huh? Guys, see, this is the left side, this is the right side. Okay, this is the cancer here, this is the lump. If you see the dark black here, okay, if you see the dark black here, this is the cancer. In this, it will be seen here. Okay, it will be seen somewhere here, not exactly seen, but it will be seen here in the lower side. This is not the cancer, this is some other organ. Okay, I'll not tell you what this organ is, but you can check out sometimes later after this class. This is the cancer. This side, this dark side is the like this dark side is the tumor. Okay, this is the tumor, the dark, very dark side. If you see here, very dark side. Okay, so did you guys get it? See, you have to be logical first. This is the same patient's CT scan. The patient has in the right lobe, right lower lobe. So this is the right side. How can the limp or lump will be in the left side? Can you please tell me? Not at all. This is the lump. And if you look at the histopathology, if you look at the histopathology, if you see these cells, if you look at these cells in the histopathology, it is very clearly shows the distribution of cancerous cell, right? This is the distribution of cancerous cell, you can see easily. Okay, these are the cancerous cells. Okay, these are the cancerous cell in the histopathology. You will not understand now, but I'll tell you in the classes. When we are taking the classes, I'll tell you everything in the class. I'll tell you everything in the class. What is histopathology, what is microbiology, and what are these tests. Okay, I'll be telling you myself. Okay, that is very important to understand in the diagnosis. So what my thing is, this course name is clinical, this is the oncology part. And here we'll be telling you about all these things in details. Okay, so this case is over. This case ID is here. You can read this case with this ID, PMID. And this case is combined small cell lung carcinoma with pulmonary adenocarcinoma. So that can be also, this is not seen here, but I'll tell you in this case, I'll take completely in the classes. Okay. Now, third case, guys. Third case is here. Very important case, guys. Very important case. Okay. The present case report is about a 64-year-old diabetic, non-alcoholic, non-alcoholic male patient who visited our hospital with a chief complaint of anorexia, malaise, and icterus since 2 months, for which he was evaluated outside with routine blood investigations. Routine blood investigations. And what was high? Serum bilirubin was 6.5 mg per dl. Ultrasound reporting hypoechoic mass 28.7 mm into 33 mm in the head of pancreas. Head of Head of pancreas. So guys, can you tell me what exactly this type of, what exactly is this? The type of cancer, what is the exactly diagnosis? If you can just tell me. Cancer of soft tissue in sarcoma. Hmm. Okay. Jaundice, pancreatic cancer. Okay. Pancreatic cancer. Perfectly fine. Pancreatic cancer. I also buy it. Pancreatic cancer, because we are talking about pancreas. See, the level of bilirubin here, it is a very very simple case to understand. Very simple case. Old diabetic patient. So old diabetic patient. So what? Old diabetic patient. So what? How it is related to the pancreatic cancer? Old diabetic patient. So how it is, like it's a diabetic patient, how it is related to the pancreatic cancer? Can someone correlate correlate diabetes and pancreatic cancer? Yes, guys. Insulin. Insulin. Oh, insulin. What is insulin? Due to insulin. Huh? Really? Beta cells of Langerhans. Guys, I don't understand the code words. Write sentences, please. I don't understand the code words. Dysfunction of pancreas. Beta cells destroyed. Cells of pancreas. Okay. Less insulin secretion you are telling about. Beta cells of islets of Langerhans. Okay. So here the condition here is due to the pancreatic failure. Due to the pancreatic failure or changes in the cells, this patient could be diabetic. Okay. Or maybe, see, this is a reversible case here. It could be like, not reversible, I'm saying, sorry. This is like, what we say is, I forgot the term. Like this is, like diabetes, because of diabetes, long-term diabetes, it could lead to pancreatic cancer, or maybe the pancreatic cancer caused the diabetes. Okay, caused the diabetes. Okay, these are the vice versa things. Yes, vice versa things. So we cannot, right now we cannot say it was because of diabetes. We don't know like how long is the diabetic, how long is the cancer, like we don't know any idea. I mean, we don't know any history or something. So when we'll deep dive into the case, then only we'll understand if it is diabetes and then cancer, or if it is cancer and then diabetes. But let's understand this case. So this case is diabetic case, non-alcoholic male, and who visited with the anorexia, malaise, and icterus since 2 months. So what is anorexia, guys? See, here there are things to understand. First, old case, definitely. Diabetic case. Okay, the risk factor is there, diabetic. And then what is anorexia, guys? Loss of appetite. Okay, loss of appetite. Malaise. What is malaise? What is malaise? Malaise. Weakness. Okay, and then what is icterus? Icterus. What is icterus? Jaundice. Okay, what is icterus? Like yellow color of skin or nails, or the yellow color. Okay, jaundice we call it. When jaundice is the syndrome. Okay, jaundice is the syndrome. Okay, jaundice is the syndrome. Right. So anorexia is less hunger. Okay, less hunger, like appetite, loss of appetite or less appetite. Okay, less hunger. Malaise is like generalized weakness. Okay, generalized weakness. And icterus is nothing but the yellow color of skin, and eyeballs, and the nails, and multiple things are there. Yellow color of these things. So it is called as jaundice. So this could be a severe patient. This could be a severe patient because of the liver problems also. So these all symptoms are liver related. Not exactly the pancreatic related. Okay, these are the liver enzymes. Okay, serum bilirubin high is the liver enzyme 6.5. What is the normal level of serum bilirubin, guys? What is the normal level of serum bilirubin? 1.2 up to 1.2.6 to 1.2 is the normal level. Okay, it is 6.5, quite high. Then ultrasound is reporting hypoechoic mass in the head of pancreas. So there was no remarkable family history. On admission, patient was in the good general health and vital signs were within normal limits. On physical examination, the sclera was icterus, yes. The abdomen was soft and the tender in right upper quadrant. So everything is intact, right, guys? We have studied three cases, right? Three cases. All three cases present to the hospital. Why I picked up these three cases? There is a very important lesson in this thing. Okay, guys, remember, there is a very important lesson in this thing. In these three cases are very simple, presented perfectly fine, healthy people to the hospital, not like a very severe problem or bedridden or something. Patients presented either completely normal just for the health checkup, or maybe was simply vomiting, or came for some limp in the breast, like very normal conditions. Okay, so this indicates that cancer in the preliminary ages, I mean the preliminary stages, it does not show any kind of symptoms. It is very less type of cancer which shows the symptoms in the preliminary stages. So it is very important for the early detection by early screening. It is very important for all of us to go for not avoid such health conditions, and to go for the screening and to check out for the cancer possibilities, to check out the early screening and early detection of the cancer. Understand? So this is very, very important lesson for everyone. If you feel anything abnormal, go and check one X-ray or MRI done or anything like definitely with the doctor's consultation. I mean, after the diagnosis, and you will get it. Okay, and early detection can be controlled. Like early detection of the cancer can be controlled easily. So let's see the things with this patient, how it was seen. Okay, so again here guys, very important here in this case. Okay, I forgot that I have taken this also, tumor biomarkers. Again, new things for all of you. Okay, can someone tell me, yes Vishwachandran, benign tumors are symptomatic usually. Can someone tell me how many of you know about tumor biomarkers? How many of you don't know about tumor biomarkers? And who knows about tumor biomarkers? Tell me. I mean, who have heard of tumor biomarkers, their ranges and all? How many of you know about that, and how many of you don't know about tumor biomarkers? Yes, guys. Don't know about tumor biomarkers? Okay, VGF. Okay, so many of you don't know about the tumor biomarkers. Very important. Okay, very, very important. Tumor biomarkers we have completed in the module of first module of our clinical diagnostics. Okay, uh, but I'll tell you, can be proteins and all. Okay, so all of you, almost many of you don't know. So there are multiple tumor biomarkers. See, first is you can see here alpha fetoprotein. Alpha fetoprotein. This should be from 0 to 8.5 nanogram per ml. But in this patient, alpha fetoprotein is 51.99 ng per ml. Alpha fetoprotein is 51.99 per ml, ng per ml, nanogram per ml, right? The second thing is carcino embryonic antigen, which should be which should be normal, like 0 to 5 ng per ml. This is 4.2, so this is normal here. Okay, the third thing is carbohydrate antigen, which is 19 to 9. I mean, that is the CA 19 to 9. This is similar, normal. And the third thing, which is very like, okay, it should be 19 to 9, CA 19.9. This is the name, carbohydrate antigen 19.9, which should be 0 to 37 international unit per ml. Okay, carbohydrate antigen should be 0 to 37 international units by ml per ml. Okay, but this was raised to 65,919. 65,919 units per ml. Can you imagine how large, I mean, how much increased this is? Too much. Okay, and these all are showing that patient could have the cancer. Patient could have the cancer. So what next we should do? Either the biopsy, either the biopsy or the CT scan or the MRI to detect the pancreatic cancer. To detect the pancreatic cancer. Let's see what we have done to this patient. Okay, so here CT scan was done. Okay, here CT scan was done, which showed the abdominal revealed 3.5 centimeter into 3.2 centimeter into 4 centimeter hypo-enhancing hypoechoic mass in pancreatic head. Okay, hypoechoic mass in pancreatic head. Can you imagine the entire case here? Entire case here is the patient was almost asymptomatic, I mean the normal symptoms, and again the patient had no family history, nothing on the examination, but the tumor biomarkers were raised. Alpha fetoprotein and carbohydrate antigen CA19-9 was very highly increased, and then when we did the CT tomography, I mean the computed tomography CT scan for this patient, we saw a large tumor or large mass at the tip of the pancreas, at the head of the pancreas. Okay, at the head of the pancreas. Now let's see what the CT scan says here. See, here is the CT scan, and here we have we had the images which are already given here. See, this is actually the mass. This is actually the mass, like at the head. Sorry, not this, not this. Sorry, not this. Okay, so in this case there were multiple modules. Okay, so this is pancreas. Actually, this is pancreas. Okay, this is pancreas. If you see, this is pancreas, and at the tip of pancreas there is the tumor. And if you look at the again the horizontal view, there are multiple hyperechoic lesions in the entire stomach. Okay, in the entire stomach. This is not the entire pancreas, this is the entire stomach. this is pancreas. Okay, this is pancreas, this is pancreas. Okay, if you see, this is pancreas here. Okay, I'll tell you the entire anatomy there. Anatomy, I'll tell you entire anatomy in that. Cyst could be differentiated from tumor by these biomarkers or could be detected in the CT as well. See, uh, we can just say, like, we can just get the images of like hyperechoic images by ultrasound, and just the images in CT scan, or the changes in the colors, changes in the mass density of the mass is changed, and that can be covered in the CT scan and MRIs. Okay, that will be teaching you by, right? So these things can be just checked. Okay, and the biomarkers are just to confirm that there is the cancerous cells in the body, right? So the antigens, biomarkers are nothing but the antigens and antibodies sometimes. So those are reacting to the biomarker, and those are saying, those are confirming that okay, there are the higher biomarkers in the circulation, so there are the presence of cancer cells. Okay, and similarly in the ultrasounds we check, like because of the high frequency of the sounds, we get the location of the cancers. And due to, like in the CT scans also, due to imaging, we check, we get the hyperechoic regions, we get the like hyperdense regions, the dense regions in the CT scans, like as you can see here. Okay, as you can see here in the second image, everything is quite white. Okay, this is the normal region of the tissues, normal tissues. But here if you look at, this is blackish, this is blackish, light blackish, light blackish, this is blackish. Okay, so these are nothing but the cancerous nodules. Okay, cancer nodules. Here you will not easily detect. Okay, here you will not easily detect, but this is the cancer nodules. Okay, I'll teach you the basics, like how we can find out in the MRI and CT scan what is the the nodules, and how we can detect it with all the organs inside the CT scan or MRI, right? So what is this? We thought it is a pancreatic cancer. Let's see. Like this is the PMID of this article. You can check out this article with this number. Okay, and then this is the carcinoma pancreas with hepatocellular carcinoma. Why we are telling hepatocellular carcinoma? Because this, in this, the liver functions also were increased. So we can see in the liver here. This is the liver side. This is the pancreatic side. So when it is attaching, this is the opening of pancreas. Okay, so this here also we can see multiple nodules are there in the liver also. So this is carcinoma pancreas with hepatocellular carcinoma, the liver carcinoma also. Okay, liver carcinoma also. So this is the case 3, guys. Okay, now case 4 and the last case, and the last case to discuss with you guys. A 90-year-old male. I have brought very simple cases for you today. A 90-year-old man was referred to our clinic with 2 months history of a gradually enlarging lesion of the left cheek. Left cheek. One enlarging lesion was there at the left cheek. He was a farmer and had a long history of occupational sun exposure. Occupational sun exposure. Sir, if it is a multiple nodules, can it be malignant? Not everything is malignant. Guys, remember one thing, cancer detection is not very easy task, okay? Cancer detection is not a easy task. So, everything is not malignant sometimes, okay? So nodules could be simple nodules also. If it's not malignant, then it could not be, lead to the cancer, right? So we have to detect again with the help of biomarkers and biopsies. Okay, with the help of biopsies. But if there is any, like if there are multiple modules in one tissue, or one organ, and one gets tested which comes the cancer, then we assume like everything is cancerous there, right? Usually everything is cancerous in that case, right? So here, guys, here, look at this, look at this, see, look at this. It is a very simple guess to you. 90-year-old male, 2 months the history of enlarging lesion of the cheek, of his left cheek. He was a farmer and had a long history of occupational sun exposure. Sun exposure. Physical examination revealed a dome-shaped 1 to 1 centimeter blue-black nodule on the cheek. Okay, blue-black nodules. Usually we call it Hindi, we call it massa or something, right? We call it massa in Hindi, right, guys? We call it massa in Hindi. So this is nothing. Yes. I'm so sorry. I'm so sorry. My pen disturbed my entire screen. Okay. buccal mucosa cancer. Okay, buccal mucosa cancer, right? Okay, you guys have started guessing also buccal mucosa cancer, but let me talk to you a little bit more. Okay, histopathological studies of biopsy specimen showed skin tissue with an irregular proliferation of large atypical keratinocytes arising from epidermis and extending to the dermis. Now tell me, which cancer is this? Buccal mucosa sarcoma or what? Guys, what you're thinking? Is this cancer? Buccal mucosa cancer? Guys, which cancer is this? Oral cancer, buccal cancer, skin cancer, whatever you think, guys. Now tell me. Is this the skin cancer? Skin cancer? Skin cancer. Okay. I'll buy this. Melanoma. Skin cancer because of ultraviolet rays. Okay. Skin sarcoma, skin cancer. Okay. I'll buy it. Skin carcinoma. According to you, I'll take it as a skin carcinoma. See, now let me tell you guys, or you guys only tell me, like, is the sun exposure, is the occupational sun exposure associated with cancer? Why we go and take the sunlight? Tell me first. Vitamin D. Because of the vitamin D, we usually go and take the, sunlight. But occupational sun exposure means, occupational sun exposure, as he is the farmer, that means it was too much. Okay, it was too much, and he might be working in the high intensity sunlight. Sunlight high intensity means the midday, maybe the midday or the noon. Sometimes he might be working for the longer timers, years. Like in the, I mean, for the years he might be working in such what we say, hours, in such hours where he got exposed to multiple time. Okay, so he got exposed to the sunlight and UV rays. So this is not, this is the mucosal sarcoma you're telling, guys, right? So let me show you. Let me show you. This is very simple. This is a very simple. Okay, this is a very simple thing. If you look at this, these are the basal cells. If you look at these are all are the pictures of cheek only. These all are the pictures of cheek only. There are the 4 types of skin cancer could be, as in this case, as I'm telling you. Okay, 4 type of cancer could be. One is basal cell sarcoma, squamous cells, like there is a pus, and then Merkel cells are there. I'll talk about all these in next, and then melanomas are there. Okay, there are 4 types of cancers: melanoma, basal cells, squamous cells, Merkel cells. So this was the pigmentous squamous cell carcinoma of the skin. Why squamous cell carcinoma? Why not melanoma, or why not Merkel cell carcinoma, or why not basal cell carcinoma? Why squamous cell carcinoma in this patient? Can someone tell me what do you read in this? This is squamous cell carcinoma only because I have written here. Why it is squamous cell carcinoma, guys? From the case, can you tell me what was the case and why it is squamous cell carcinoma? Yes, everyone. Yes, tell me why it is squamous cell carcinoma. Arey, look at this. Look at this. Black color, blue black nodule, blue black nodules. Okay, blue black nodules and proliferation, irregular proliferation. These are the major these are the major characteristics of squamous cell carcinoma. Squamous cell carcinoma is, like, if you see that black color, and yes, keratinitis is there also. Keratinocytes are there, atypical keratinocytes, but there's a secondary thing. First is black nodule and irregular proliferation. If you look at the proliferation, irregular proliferation, irregular proliferation, irregular proliferation of the cancer here. So this is the cancer. This is the squamous cell carcinoma, squamous cell carcinoma of skin. This is the PMID. You can access the case here. Okay, this is the squamous cell carcinoma. Okay. The third one is quite common. Is it the suppressed form? No, 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 no. This is not the suppressed form. This is the type, like there are multiple times. Some are coming out. Some are like this, only the black color. Okay, some are like only this black colors. Okay. So these are the things, guys, what we wanted to discuss with you today. And there are multiple types of cancer. I'll just ask you, you guys can tell me what are the types of cancer here. Like, yes guys, just tell me brief, and then we'll take the question answers, and then we can, take off the class. Yes, these were the four cases I want to discuss, and these will the four basics cases I'll be discussing in the breast cancer like oncology course. Okay, now guys, tell me. In 5 minutes, we'll share the feedback form only. Today's class is just 1.5 hours. That's all. 1 hour only. Yes, guys. Anyone? Types of cancers. Based on the organs only, you tell me. Breast cancer, lung cancer, skin cancer, pancreatic cancer, carcinoma, head and neck cancer, leukemia. Yes, leukemia, blood cancer. Leukemia is blood cancer only. Melanoma and sarcoma, lymphoma, prostate cancer. Okay. So, okay, myeloma, bone cancer. Okay. There are different things we will be discussing. First, I'll tell you. One is based on the location. Based on the location. Then second is based on the histopathology. Histopathology. And then there are other classifications also. There are multiple types of classification, but majorly we divide the cancer based on the location, like which organ is involved, as you are telling rightly, cervical cancer, prostate cancer, lung cancer, brain cancer, brain tumor, or there are multiple types, right? Bladder cancer, leukemia, like uterine cancer, ovarian cancer, colorectal cancer, all are there. Adenoma, lymphoma, those are like based on the histopathology. And like benign cancer and severely developed cancer. So multiple types of cancers are there. You guys can read. Yeah, we will be talking about all those. Okay, we'll be talking about all those, right? Then etiologies of cancer. Etiologies of cancer is totally depending on, like, every cancer has different etiology. If you talk about mouth cancer, oral cancer, etiology is tobacco chewing or exposure, dental unhygiene, multiple types of that. If you talk about lung cancer, it is like alcohol, smoking is one of the major, and the dust exposure, and the high heavyweight metal exposure, or the gas exposures. Multiple things are there, right? If you look at the colorectal cancer, then there'll be like viral infections, bacterial infections, gastric reflux disease for the multiple years. And then as we were talking about, every thing has the different etiology and different risk factors for every cancer, right? There are like few common risk factors or etiology, but other cancers are usually, the cancers have the different etiologies. Okay, different etiologies, right guys? Okay. And yeah, so prevention of cancer means leaving these smokings and all, everything, and then we can talk about. So guys, now you tell me the questions, and by the time I will be sharing the links. Okay, I'll be sharing the links of the feedback. Okay, yes, I can see there are the people in the YouTube also. Due to insulin insufficiency, people are reacting from the YouTube also. I was seeing them. Okay, and strictly you cannot share this form anywhere, and everyone who is here has to fill that form. Later, please don't tell me. Okay, now only you fill this form. Okay, guys, right? And you can write your questions here now. Please ask your questions also. Please ask your questions also. Please ask the questions. Okay, and I hope you liked these four cases, guys. I hope you liked these four cases. These four cases, I literally won't believe that I read today about these four cases. I mean, I was searching for multiple cases. I read multiple cases. Okay, not only one case, but multiple cases. And then I, got these cases. Then I got these cases because these cases are one of the very simple and easy to understand cases. In the classes, I'll be taking more tougher cases. I'll be taking more tougher cases, more complicated cases where you can tell me or we can discuss the things. So that is the, like, first is the feedback link. Second is the registration link for the course if you are, if you want. Okay, I'm sharing the links in the, this is the registration link in YouTube, and this is the feedback link in the YouTube, guys. YouTube guys, also please fill the feedback form, and if you want to register for this course, you can easily register through this link. So after this class, you will not get the feedback link. Remember, this feedback link is open just for next 2 minutes if you're not asking the questions. Second case is the rare case. No, 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 nothing is rare. Very simple cases. Feedback form I have shared here. I have shared the feedback form here. You guys are joining now. Then I'll share again. This is the last time I'm sharing the feedback form, and this will be open only for the next 2 minutes. Next 2 minutes only. Only next 2 minutes. Okay. Only next 2 minutes. Yes, guys. Only next 2 minutes. Yes, guys. Fill the feedback form, please. Okay, there's some question. If I believe I have seen patients with no physical lumps that can be found in touch, but the patient was suffering from the breast cancer. How to diagnose in such a irregular MI CT scan? No, simple mammograph. Mammogram is the simplest technique. Go for mammogram. Even the young ladies after 23 or 24 years, they usually go for the mammogram every 3 year. Okay, every 3 year, and after 30 35 they go for mammogram every year. Just a basic screening. This is a basic screening. Okay, this is a basic screening, Muhammad Jair. It is very important, for the ladies when they are in the breastfeeding age after marriage with the kids. It is very important for them to check the mammogram every 3 years at least. Link for the clinical diagnostic is given in the is it the diagnostic case? Wait. Oncology, I'm saying. One sec, guys. Okay, by mistake, I think I've shared this with you. Okay, let me share the correct link. Oh, you. Oh, I think everywhere we have shared only the, not the, okay. Oncology link. 1 second, guys. 1 second. Yeah, even in the link, I think I have shared, like they did not change my team. I think forgot to change. But let me share the correct link with you guys. Yes, guys, I'm just sharing. Just give me a minute. And by the time, okay, oncology. Yes. Okay. So here is the link. One sec, guys. Yeah. Now here is the link. I got the link. I said I did not have the link, I believe. So copy link. Receive the certificate by tomorrow. Now over. So I'll send this to my team. They will create. Okay, this is the link for the registration to the oncology course, guys. Okay, this is the link. How about diagnosis for pediatric population? We'll be discussing in the master's class session. Yes, definitely. We'll discussing the pediatric oncology also a bit about. Sir, is it mandatory for all interns to? No, not at all. Not at all. For oncology or diagnostics, not at all. I have shared the link, especially for the interns with half rate. That is like the condition for our interns. That's for 499 they can register for. Certificate will be sent in the group and in your emails, guys. Don't worry. Okay. Tumor biomarkers are usually similar to everything, but sometimes genetic biomarkers are different for different tumors. Okay, that will be covering up. If you want, if some register or some interns want to register to this course, I'll send the link again, and someone can send the link. Guys, you fill the feedback form. I'll Yes, guys, so it is over, right? Okay, thank you very much. So please register. Whoever is interested, please register to the course. Okay, whoever is interested, please register to the course. And sorry, so you can register to the course. Feedback form I have shared multiple times. And even the, okay, here is the oncology course. Okay. No, 26 was the last date, but don't look at the 26. You just fill the form. I mean, you just register. If you want to register, please register for the oncology course. Here is the course link. YouTube guys, this is the new course link. This is the correct course link. YouTube people, whoever are in the YouTube, this is the YouTube link. I mean, this is the link for the oncology class. Okay, oncology course. Okay, this is the class for oncology. Okay, guys, so I'll see you. Now we'll keep this like we'll turn off the links, feedback links. If you have, I expect that you all have filled. Expecting many more. Guys, register to this course. Course is going to be fantastic. These both the courses are one of my favorite courses, one of the oncology and the diagnostic part. Okay, please go for it. Okay, guys. Okay, thank you very much, guys. Take care. Chalo, we'll end the class. See you on Sunday. Sunday will be the orientation classes for these courses. Sunday will be the orientation classes. Okay, guys, good night. Have a good meal. Register for these courses. Okay, bye bye. See you.